going to be facilitating our session today with Dr. Stavrou. Sorry, I
Stavrou.
feel like Stavrou.
Mhm.
And so thank you again, Doctor, for meeting with us and taking all of that time out of your busy schedule to kind of fill us in. So whenever you're ready, the floor is all yours.
Yeah, of course, no problem. So hello, everyone. Thank you for joining in this evening. My name is Stella Stavrou. I'm a maxillofacial and board certified prosthodontist. I wanted to share with you a little bit today about my journey, some tips I may have for you, and a little bit about what my specialty involves. So first, starting off a little bit with my journey through dentistry. So beginning a little bit about myself, I'm originally from New York, and that's where I did my undergraduate and dental training. I went to Stony Brook University, and then I did my dental training at Stony Brook School of Dental Medicine. In dental school, I went into it kind of with an open mind to all specialties. I liked oral surgery, perio, pros, and in New York, residency is a requirement for licensure. So that's why I ended up applying for a GPR residency program. I wanted to be a great general dentist that focused on quality care and to be able to do it all. So I did GPR, and then I ended up staying for a chief year also to focus on treating those more complex cases. So even after those additional years of training, as they say, the more you know, the more you realize you still don't know. So I had a few mentors who were prosthodontists, and they were able to have such a clear vision for treatment planning and conceptualizing some really challenging cases. And I'll share some with you a little bit later, but that's when I decided to apply for a prosthodontic specialty program. So I did my GPR at the West LA VA, and then I continued on to do 3 more years also at the West LA VA in pros. And then I did an additional 1 year of subspecialty in maxillofacial pros at UCLA. Currently, I am teaching at UCLA part-time and working part-time in some private practices just north of LA and north of Sacramento. So some things that I've done in my journey through dentistry are research, including presentations and posters at various conferences, joining organizations. I joined ASDA, which is the American Student Dental Association, even as a pre-dental student. So I was able to utilize some of their resources, get involved in the dental community, and advocating for your specialty. Community outreach in dental school. I did a 1-month-long outreach mission trip to Madagascar. And even from being pre-dental too, I did local outreach efforts. And some hobbies of mine are running, skiing, and hiking. So starting off here, directing towards you, my first question to you all today is, why dentistry? So I'm sure a lot of you have maybe even had this question already asked of you. It's also going to be a huge interview question if you weren't already aware of that. And it's something I still get asked by my patients to this day. So my best advice to you to find your answer to this question is to get exposure in dentistry. So starting even, being a part of these virtual shadowing sessions, whether it's shadowing, working part-time, working as a dental assistant, you want to be able to at least see what you're getting into in dentistry. So even still to this day, I'm still shadowing colleagues and visiting different offices to learn what opportunities there are in dentistry and in specialties as well. So get out there, shadow your dentist, shadow your parents' dentist or your pediatric dentist. And if you have family members in dentistry, shadow them as well. So some goals I'd say to have from undergraduate is to develop good study habits. Up until the last few months, honestly, studying has been a regular part of my life. In dental school, studying for classes, then there's dental boards and licensure, and then into residency, you have examinations on literature. There are mock boards and specialty boards. So you really need to start to feel comfortable with studying and find what study habits work best for you and be ready to have those productive days. Even throughout dentistry, the field is changing and there's continuing education and ongoing learning. So it's a really big part of dentistry to be studying and reading lifelong. So thinking about dental school applications, and as I was talking to the hosts a little bit before we went on to this session, thinking about these dental school applications earlier, the better. So I think the biggest help is to be prepared and be aware of what goes into the applications, like your grades, DAT, personal statement, letters of recommendation. Thinking of a unique personal statement as well is helpful. So the earlier you get it done, the earlier you submit your application, the better. Also seeking out research opportunities. In undergrad, I actually did some research in an anthropology lab, which is working with fossils. And it was a lab that happened to be working with tooth fossils and tooth fossils in the human lineage. So although it wasn't technically dental research, it still opened doors for me in the anatomy department, which is something that you'll definitely have to take in dental school and know for residency as well. And it also opened doors in dentistry. You can do research. You can also do literature review research, which, as it sounds, it's reviewing articles and putting information together. So there are opportunities, and sometimes you can even present posters as well. Get involved, join your local pre-dental chapter, or if you don't have one, make one. Try to be well-rounded, join clubs or other activities you might be interested in. And then find your hobbies and passions. For me, it's running and fitness. I ran 2 marathons in residency, and it kind of helped me have something to look forward to after work hours to keep me motivated. And I'd also say to work on your hand dexterity, like art projects. I picked up the art of quilling. I also have a background in music, but other things you can do are painting, drawing, baking, pottery, cake decorating, rock climbing, or even sports with hand-eye coordination. And I'll show you a little reasons why later that the hand dexterity will come into play. So some things that you want to look into for dental school. So I'd say, also as soon as you can, when the time comes, try to start to research what the different dental schools have to offer and the differences between them. So you want to make sure to see what dental school would work best for you. So what is the class size? Here I have a photo of what my dental school class looked like. At Stony Brook, we were a class of 40. I think it's up to maybe like 48 or so at the time, or now, but it was 40 at the time. I was looking for a smaller class size and a school that had really good clinical experience. In undergrad, my Gen Chem class was really large. It had over 1,000 students that was divided into 2 classes. So I was looking for a smaller class size in a dental school. What might the tuition and other fees be? And from that, what might your loans look like if you were to go to that school? If you're thinking of specializing, something to think about is if there are post-grad programs, that way you can shadow the residency programs and explore them. It's great because you'll be able to have the specialists there and be able to, refer cases that might be a little more complex. But a downside is that you might not be able to do the treatment for those complex cases because the residents are going to be doing the treatment instead. But if you're lucky, the residents might still keep you involved in the case and you'll be able to still learn and follow that patient through treatment. Another question is how often do the students see patients? There are some dental schools that see patients 5 days a week come 3rd and 4th year, but some dental schools only see patients every other day. Are you limited to the number of patients that you can see per session? Some schools only allow for students to see 1 patient per session, but some allow you to see multiple. So that might also affect the amount of patients that you see in your clinical experience. And now another big thing I'm seeing in dentistry and in the difference between dental schools is digital versus analog. So are you learning only the digital side of dentistry, or is the dental school still doing analog, or does it have a hybrid of both? So that's kind of the biggest pivot in dentistry now. A lot of practices are adopting digital tools, but there's definitely still a place for analog and conventional dentistry. So if it's a program that kind of has a good hybrid between the two, I think that's also a really, really good plus. So now some tips for dental school interviews. Number 1 is be prepared. Look at the school's website and make sure to ask the right questions about the school. Another thing for being prepared is to know the popular interview questions. Like my question I had for you before, why dentistry? You are going to get asked that question. There's no doubt about it. Another question is, what are your strengths and weaknesses? How do you handle stress? How might you react in an ethical situation? Or where do you see yourself in 5 years? So these are all questions that you might get asked. And if you do happen to take a gap year, you might even have more experience in answering some of these questions because maybe you went on some more interviews during your gap year as well. So it's not always the worst thing in the world. You can experience some other field. And make sure to know your application well. You don't want to get caught off guard. Dentistry is a small world, and your interviewers might know somebody that you listed on your resume, for example. So at least go in confidently that you know yourself and you know your application. Mock interviews are always so helpful. Even some dental schools even offer them through their school. So you can hear what kind of questions they tend to ask. And I would say try to do mock interviews, ask around, maybe some other mentors offer them too, just because people might ask different questions so that you can be best prepared. And remember, you are interviewing the school as much as they are interviewing you. I think this mentality kind of switches things around, and it made me feel more strong going in as I approached the interview, because I'm thinking, do I see myself here? Is this a good fit for me and what I'm looking for? So it's kind of, you want to make sure that it's you're going into that interview for yourself, but you also want to make sure that it's a school that you're looking for. And make sure to have your questions ready too. That kind of shows that you're interested in the program. Ask about the school, ask about the clinical experience, research and outreach opportunities. And then also, I hope that you have opportunity to talk to current students as well. Those good questions for them are asking about housing and location, why did they choose that school, and what do they enjoy most about that school. Another thing, not just dental school interviews, but residency interviews as well, is that they can get expensive, especially if you're planning on going on multiple interviews or applying all around the country. So make sure to save up and plan accordingly. And last tip is be yourself. You got this. So now going into some residency application tips. Now, some states require residency for licensure. Some don't. So these are just some other things that you want to think about in addition to the previous that are, that will help you kind of look into which residency program's best for you. So is it a paid program or tuition-based? There are paid programs for almost every specialty, even perio, pros, and ortho. So you just need to put the time in to research what those programs are. Another good question is if there are benefits like health insurance, dental insurance, vision, retirement, and will that be covered for you, or are you responsible for that cost? Another question is, what's the cost of living in the area and what's the transportation in the area? What's the rent like? Is there a lot of traffic? How close do you have to live to the residency program? And then the next question, kind of stemming off of this, is what is the on-call schedule like? So some residencies that require for you to be on call are like GPR, hospital dentistry, OMFS, pediatrics. So some require you to live very close to where that residency program is. And some of those specialties you will have to go in overnight. But for example, the GPR that I did, it was a rare occasion that we had to go in after hours because most dental emergencies were managed by the ER until the work week. So it kind of depends on the program. How many patients do you see per day or per week? Or what is the referral situation? What does the referral situation look like? I can't speak for all residencies, but I do want to point out that I did my training at the VA program, and through the VA, the Veterans Affairs, the cost of the treatment is covered for the patients who are eligible for dental care. So in that way, we would prioritize what treatment is best for the patient after a discussion of risks, benefits, and alternatives, and we can proceed with treatment without having financial restrictions for the patients. And then another word of advice is to visit the programs and see it in person. I know this kind of was a little bit halted during COVID, but from what what I hear from most programs, they're back up and running. And, if you can take time to visit those programs too, ask the resident questions and how they like the program, it's really helpful. So now going into the specialties of dentistry. So these are the ADA recognized specialties that you'll learn all about in dental school, and they all stem from and have some overlap with general dentistry. So all of these specialties, there is a place for all of them. We collaborate and work together on a number of cases. And my best word of advice going into dental school is to keep an open mind to all specialties. That way you can get the best out of your dental education. And then if you do end up specializing, then you know about the other specialties and when it is time to refer, and you can also properly collaborate with other specialists as well. And you never know what doors might open for you and what might actually be the right path for you. So my journey started in general dentistry, and then I ended up pursuing prosthodontics. So now I'm going to talk about a little bit of what prosthodontics is. So prosthodontics is a dental specialty pertaining to the diagnosis, treatment planning, rehabilitation, and maintenance of oral function, comfort, appearance, and health of patients with clinical conditions associated with missing tooth structure, missing or deficient teeth, and or maxillofacial tissues. So really what falls under the umbrella of prosthodontics is dentures, partial dentures, implants, veneers, and crown and bridge. So that can all get broken down essentially into removable prosthodontics, which is something that gets removed in and out of the mouth, and fixed prosthodontics, which is something that stays in place. So although pros can do a single tooth restoration or a few teeth restorations, really what we look at is the big picture. So a lot of these patients have more than just one tooth problem. So we evaluate, diagnose, and treatment plan for what's called full mouth rehabilitation or full mouth reconstruction. So I was curious what ChatGPT had to say about what pros is. So I plugged it in here, and I have to say I was pleasantly surprised. Thank you, ChatGPT, for representing our specialty well. So pretty much all the components that I mentioned in the last slide were listed here with the addition of TMJ disorders. So this is kind of what the origin of pros stems from, which was treating the TMJ system. So your TMJ is your temporomandibular joint. You have a right and a left, and it was really focusing on how the TMJ affects the teeth and how the teeth relate to the health of the TMJ. Another component mentioned here is maxillofacial pros, which was what I ended up specializing in too, that I'll show some examples of later. So while ChatGPT did a great job of giving an overview of the specialty, one thing that they failed to mention is the long hours that goes into some of these cases. So there's hours of treatment planning, reviewing CT scans, implant planning, waxing and sculpting prostheses. So hopefully if you end up specializing in prosthodontics, you'll have some cool co-residents to keep you company in the lab, but there are a lot of long hours that go into it. So prosthodontics really creates the blueprint for treatment by putting the teeth in the right position to then plan what treatment is needed to get from point A to point B to point C. So putting the time in to properly recognize and diagnose all the problems happening, sequencing the treatment, and then we'll be able to achieve a better end goal. So next, I'm going to show a series of actual patients that I've worked with in residency and fellowship, and just want to give a heads up on some photos. So here are some examples of cases I saw in residency. So in some of these photos, I want you to take a look, and I'm going to point out that these patients have missing teeth, broken teeth, severely worn teeth, crowns and dentures that are breaking, bite problems, crowding, habits, and pathologic processes that if they're not addressed, will continue to just get worse and worse. So we rely on working with our other specialty colleagues like ortho, oral surgery, perio, endo, oral facial pain, dental laboratories, and even pediatrics for congenital conditions like cleidocranial dysplasia, ectodermal dysplasia, or cleft lip and palate. And we work together from taking patients from this to this. So restoring their smile aesthetics and function by restoring the missing tooth structure and replacing the missing teeth. So a lot of this doesn't happen overnight, especially if the patient is undergoing ortho first and getting implants that need to heal. So this process can take years in order to complete. So now I'm going to kind of break it down into the different topics that PROS covers. So starting with complete dentures. So most things in dentistry derive from complete dentures, which is putting the teeth in the correct position when you have nothing for reference. So in this case, impressions are made, custom molded for each patient. And once the bite or occlusal registration is obtained, we can then do the tooth setup. So here's where some of these artistic skills come into play and the hand dexterity skills come into play. So the teeth are preformed, but each tooth is custom positioned. And then the gums are custom waxed for each patient for conventional dentures. Most dental schools are still having dental students do this. So each dental student is doing their own dentures, waxing their own gums, like as you see here. So something to be prepared for when you get into dental school. And then this is the final product. So this is a complete denture. It's a removable prosthesis that the patient takes in and out every day to replace missing teeth. So now once the teeth are in the right position, then we can use that as our guideline, as our blueprint for properly planning for implants. So here, this is a CBCT planning that the CT is scanned and digitized and everything is overlaid onto each other for planning the implants in the proper positions. So we look for the amount of space for the prosthesis, the distribution of the implants, the angulation of the implants, if any additional components are needed, where the implants are in relation to the residual bone, and how they are in relation to the prosthesis. So really, we look at a lot of different things all together when evaluating these CTs, and then we can create kind of like the final end goal so that the patient has replacement teeth. So now I'll show a couple examples of how implants can be utilized. So here's an example of how implants can be used to hold in a complete denture. So this is a removable prosthesis, so it comes in and out, but the patient is able to take it on and off with the assistance of some of these clips that you see that are connected to the implants. So then that makes it a little easier for the patient to clean. And the implants, you can see those attachments that are penetrating through the gum tissue that have the clip components to hold the dentures in. Now, next up is partial dentures. So it's similar to complete denture in that it's removable, but partial denture is only partially replacing teeth in the arch. It's not replacing the whole arch of teeth. So here's an example of what that is. And in this case too, it's a patient who had implants to help hold that partial denture in place as well. Now looking into fixed prostheses with implants, the difference between removable and fixed prostheses is that a fixed prosthesis stays in place and is only able to be removed by a dentist with a specific screwdriver, with a specific implant screwdriver. So if you look at the diagram in the top left, it shows the removable attachments, and then in comparison to the screw channels that connect down to the level of the implant. So here in the photos, you can see that the implants are positioned in the jaw and the prosthesis is then fabricated for the patient to wear, and they're permanently in place to restore the patient's aesthetics and function. So now I'm going to go into full mouth rehabilitation. So this case kind of includes a combination of, full mouth rehabilitation in general can include a combination of crown and bridge, implant, veneers. This case included crowns, implants, and veneers, a combination of all of those. So I want you to take a look at these photos here and kind of think, what do we see? There are teeth with tooth decay. There are old bridges that are breaking down. There is tooth wear. There are missing teeth. So again, if this is not addressed, the process will continue to progress and get worse. So what is done is starting with the planning, then removal of infection, ortho treatment if it's indicated, any surgical treatment like implant placement and healing, And then last but not least would be the prosthetic rehabilitation with the prosthodontist. So what is done is these teeth are prepared down after all of the preliminary phases. They're prepared down for crowns by drilling on those teeth and taking a look at what that is. Obviously, we can't send the patient home like this. So based on our plan, we make temporary crowns that are temporarily cemented in order to protect the teeth, test out the aesthetics, and evaluate function. So I have photos of what those temporary crowns look like here. So they essentially could look like what the final crowns are, but especially when we're making modifications to the bite, we want to be able to evaluate if the patient's going to be able to tolerate that and also check for the aesthetics. So then here is the final completed case. So I wanted to include the x-rays because you can see a combination of all the different materials that were used. So there were implants that were placed into the bone. There's a combination of different gold alloys, porcelain, and ceramic. And then similar to the provisionals, the temporary crowns, this is what the final crowns look like. So then we're able to take the patient from this, having worn down teeth and failing dentition, to a healthy smile, restoring aesthetics and function. So now I'm going to go into a little bit of what maxillofacial prosthetics is. So this is the oral and facial rehabilitation of patients affected with head and neck cancer, congenital malformation, or acquired traumatic defects. So now maxillofacial prosthetics is more focused on working with our medical counterparts and with collaborative efforts between head and neck surgery, ear, nose, and throat doctors, radiation oncology, hem-onc, and then with our dental colleagues in hospital dentistry, OMFS, and oral pathology. So let's talk a little bit about head and neck cancer. So the American Cancer Society's most recent estimates for 2023 are over 54,000 new cases and over 11,000 deaths from oral cancer. So the lifetime risk is 1 out of 60 men and 1 out of 141 women. So I have a photo here of the most common sites of where oral cancer is usually found. So it's the tongue, tonsils, and oropharynx, and the floor of the mouth. So I have those outlined in the colors here. So there's no better time than now to stress the importance of doing oral cancer screenings as you're entering the field of dentistry. You want to check all areas of the mouth for cancer, not just these areas. And the sooner the cancer is found, the smaller it is, the better. So now I'm going to go into a couple of cases of patients who not just had oral cavity cancer, but head and neck cancer, and they were rehabilitated with different prostheses. So here's an orbital prosthesis that was made for a patient that had her eye removed. So this patient, when I saw her, already had implants placed when I made her prosthesis. But you can see, remember the photos of the complete denture impression I showed you? It looks almost similar to the complete denture, similar technique, but this is for the orbital prosthesis. And an iris and a pupil were hand painted to match her opposing eye. And you can see those implant attachments on the back of the eye. And then the prosthesis is hand sculpted in wax, processed in silicone, and then hand painted on the patient's face to match the opposing eye and the borders. So a couple other examples of what facials can look like. Here is another orbital prosthesis that is held in by adhesive. This is a partial nasal prosthesis for someone who had part of her nose removed from melanoma, and an ear prosthesis fabricated that is also held in by implants. So now I'm going to switch to a couple cases that apply to the oral cavity. So first, I want you to take a look at the top left photo here. So can you spot the difference from one side of the jaw to the other? If you look at the patient's right side, the upper jaw looks a lot more swollen. That's the area of where the cancer is. So this patient had nasal cancer that had grown down into her maxilla, and it even had an extension coming out through her nostril. So that section of the upper jaw is removed and a prosthesis is fabricated called an obturator prosthesis. So the importance of this prosthesis is that without it, patients wouldn't be able to speak or eat normally. Anything that they would try to eat or drink goes right up to the nose and comes out of the nostrils, and when they try to swallow, and even their speech is very hard to understand because it creates this hollow sounding voice because air flows up into the nasal cavity, and it's very challenging for these patients to articulate. So this is with the yellow outline, this is a temporary obturator that is fabricated, and it's made as a temporary because in the initial phases of healing, there are a lot of changes. So things need to be adjusted and modified while it's healing. And then if you look on the right-hand side, this is when the final prosthesis, the starts of the final prosthesis being fabricated. So here I am showing a side-by-side of the temporary prosthesis and the final prosthesis. And we are able to create a prosthesis to restore her smile and replace her missing teeth and giving her confidence back after a long road of cancer treatments. Now, fortunately, in this case, we were able to maintain some teeth, but in some cases, the cancer grows so large that we are unable to keep teeth because of where the cancer resection margins need to go. So here's an example of a patient who had to have the entire upper jaw removed due to cancer. And with the help of zygomatic implants, so these are implants that are placed into the zygoma, the cheekbone, we can place implants and have an implant bar to help hold this prosthesis in to restore the smile and function. So the top photos are the temporary prosthesis with a temporary bar, and then the bottom photos show the final bar and the final prosthesis, and we're able to restore her replace her missing teeth and also create that partition that she's able to eat and speak properly. So now I'm going to go into the lower jaw. So this is the last case I'd like to highlight that demonstrates the broad field that dentistry covers. So this is a large tumor that is growing, that presented when in a young patient's jaw that was growing. It's actually a non-cancerous tumor, but you can see the extent of how large it grew to. This patient was only 20 years old when he presented with this tumor. So next I'm going to show a video of the planning of implants in a similar case where the jaw is reconstructed. And I want to point out that with medical innovations, the jaw is able to be reconstructed with the leg bone and also planned with implant placement as well. So with the help of head and neck surgery, microvascular surgery, oral and maxillofacial surgery, the implant planning team, and your maxillofacial prosthodontist, we can discuss all the planning for the restoration of this patient. So this is the leg bone that is superimposed and repositioned based on the proposed tooth positioning. And then the implants are imported in, and they are repositioned and modified in relation to the teeth. So similar to the other video I showed, the teeth are here in pink. So those teeth are kind of the blueprint for where the implant positionings are going to be and where that leg position is going to be for the final reconstruction. So this is how the patient presented, and you can appreciate the extent of that tumor. And then what we get after that planning session are some 3D printed models. And here you can see that model with the prosthesis in place in preparation for surgery. Then on the day of surgery, the implants get placed into the leg bone. Then the prosthesis is screwed into those implants and brought into the jaw all together to help reconstruct that mandible. So now this saves time and it saves the patient additional surgeries and allows the patient to get a final prosthesis maybe even sooner when everything has healed. So it's a pretty impressive case that now with technology and with innovations in medicine, we're able to provide this service for patients. So that's all I have for you here today. And I want to move on to any questions.
Great. So there are a couple of questions in chat, so I can just kind of read those out to you right now. And if anyone else has any other questions, y'all can just drop them in the chat and I'll get to them as I read through. But so one of our first questions is, how do you get dental shadowing opportunities in clinics? I had mailed many dentists, but didn't receive a positive response. So do you have any advice on going about that?
I think that's kind of tough because if you're looking to have shadowing experience in clinics, it's usually a very dynamic space because there's more than one person working there and there's a lot of patient turnaround. It's a very busy space. So maybe as pre-dental student, they may not be as accepting to having shadowers come through there. But we, even at UCLA, we've had some pre-dental students come through. There are some opportunities. So I would say if there's a local clinic near you, they may just have a specific process for applying to shadow. I did that too when I was a pre-dental student as I shadowed Stony Brook, but they had, I had to submit an application and be accepted. And then they had all this paperwork. So I think you just have to try to find the right person to connect with and kind of go through those proper channels.
So our next question is what did you specifically look for in a dental school?
So in my dental school, I was looking for a small class size. I wanted to have really good clinical experience. That was something I really wanted to look for in a school. It kind of depends on each person. There are schools out there that are more focused on getting medical background. There are some schools that are more focused on didactics. There are some schools that you're taking classes together with medical students. There are schools that are bigger class size. So what I hear from some of my colleagues that went to some schools with bigger class size is that it really is what, you make your opportunities and you kind of make the most of it. So it depends. It's different for each patient, each person, but you have to kind of evaluate what you're looking for in a school. So for me personally, it was a smaller class size and good clinical experience.
Next question is,
and also to add on, it was in-state tuition for me also.
ooh, yeah. So next is, what motivates you to go in and work on patients every day? And kind of in conjunction with that, how do you balance work and social life?
So what motivates me every day? I would say that dentistry is evolving so much. And in the beginning, it's hard to appreciate that. You're just trying to get a grasp on what dentistry is. But now that I've been in the field for a little while, I see even changes happening like right before my eyes. So what's motivating is that, you're still being able to help patients, treat patients every day, but you're striving for trying to do the best that you can and make those improvements and trying to make care more accessible, faster, easier, just what can we do to take it to the next level? And then the second question on that is work-life balance or something like that. So I'd say like it's tough. It's really tough. There are some times that you're gonna be off balance for sure. There are some weeks that you have to put the time in studying. I'm sure you're aware of it already. Sometimes you're gonna have to compromise one or the other. But I would say try to put time into your schedule every day to take time for yourself. So whether it's in the mornings before you start your day, do some yoga or some exercise, or if your time of day is doing it in the evenings, make sure to take some time, make sure to, keep your connection strong because it's a long road. If you lose touch with who you are, it's a long road of long training. As you can see, I did like 14 years of schooling. So there's no time to waste. Make sure to keep those connections strong, keep your family and friends strong so that you can have that balance in life.
The next question is, would you recommend taking a gap year?
I didn't take a gap year, but I regret it. So it really is what you make of it. I would say there are, if you do take a gap year, make the most of it. Whether it's you're working in dentistry, getting exposure to in dentistry, you can work as a dental assistant, you can work in a dental lab, you can, be shadowing on a regular basis, or you can do something entirely different from dentistry. That's your time to travel. That's your time to get professional experience in a different field, interview experience. These are all things that, life experiences that you're going to most likely bring into dentistry. Dentistry is a business at the end of the day too. So having maybe business experience or service industry, sales experience, these are all, you're going to have skills, you're going to develop skills that help. So if you do take a gap year, definitely make the most of it. I wish I had taken a gap year.
So when you were asked in your interview, like, what did you answer with when they asked the question, like, why dentistry?
Why dentistry? So my answer was, so I have two answers actually. So my one answer is that in high school, I was thinking about majoring in music and pursuing a career in music. And I was like, oh, I don't know. Is that right for me? You know what? I'm just going to be a dentist. So I kind of one day woke up in high school and said, I'm going to be a dentist. And that was it. And like I said, I didn't really have the mentorship that I needed early on in college. So I wasn't aware of everything that went into it, but I still made it work and pursued that career. But my other answer is that I was involved in music and art. That's kind of where my background is. And also was really good at science. So kind of like the hybrid of dentistry is the combination of science and art. So as you saw from some of the example patient cases I showed today, a lot of art skill does go into it. Like we're even painting these prostheses, custom painting these prostheses. So, it might be a little bit more related than you think.
And the last question that I see on here is, how do you know what teeth shapes to use to replace the missing teeth? Do you use model teeth, remove teeth, and the existing teeth, or all of the above?
That is a good question. And it actually is, there are probably hours and hours we could spend talking about that. But the long story short is that essentially what we do is find out first kind of where the two front teeth go. So we determine that's called like the incisal edge position. And then from there, we determine what the midline position is. And then there are special measurements that can be done in order to find out how long the teeth needs to be, how wide the teeth need to be, and where the occlusal plane is going to be. So basically we want to make sure things are level instead of being crooked. So from all of those like reference marks, we can determine what teeth to select. So there's a whole booklet of teeth. If you're setting up a denture, for example, there's a whole book of teeth that you can look at, and they have different measurements and different dimensions, and you can kind of choose from that whole database.
Okay, we have a couple more questions now. So what is the most challenging aspect of dental school?
The most challenging aspect in dental school, it may be, I guess there's like a few challenging aspects in dental school, depending on where you're coming from. So it might be kind of changing your study habits a little bit. Like it's still good to have strong study habits, but dental school, you're going to a new place, maybe they teach things a little differently. That might be a tough adjustment in the first semester. Another challenge in dental school is navigating the balance of studying for your clinical class or your didactic classes, but at the same time, like come second, third, fourth year, you're also treating patients. So being able to still have time to study, but not fall behind on your lab work, and you still want to do good patient care. So that's another challenging aspect. And then last thing could be, making sure to find that work-life balance, because, that time is going to be lost if you're only going to be keeping your head in the books. So it's like I say again, make sure to take time for yourself every day, and have that balance in life too.
And then what was your favorite and least favorite part of your dental career so far?
What's my favorite and least favorite part? So I guess my favorite part is the big delivery days. Like it's so exciting, or like the big change days. You know, maybe it's that preparation days when we send the patient home with temporary crowns. You know, that's so exciting. I get so excited, maybe more excited than my patients, that I'm like, look at your new smile. Like, isn't that so exciting? So I think that's so rewarding. And, you know, all the time that goes into the planning of the case, you know, makes it all worth it. Least favorite part is dentistry is really hard. Dentistry is really tricky. And, you know, sometimes you're going to have to think on your toes. Let's say, you know, for example, there's an implant component that is tough to work with, or it's, you know, implants have been around for over 50 years now. So, or so, but let's say it's a really old implant component you're trying to figure out. Like sometimes it's really tough to think on your toes, and you have to send that patient home in a stable condition. So, you know, trying to think on your toes and, you know, figure it out in the spot is my least favorite part. It's tough.
Can you speak more on how one can develop one's business skills in dentistry? Is that something that you see as like really important?
Business skills. So I'd say like as a whole, usually a dental office has a whole team to it. So usually you'll have an office manager, you'll have your assistant, you may have a treatment coordinator. So everyone kind of has their own role. And what I appreciate most in like places that I'm working is that my role is to focus more on the dentistry side of it. So I don't feel like so much so that it's a business, but I also don't own my own practice right now. So maybe that's the reason why I don't see it so much like that. Usually you have a office manager or a treatment coordinator that's kind of like, you know, looking at that business. And then of course the owner dentist is looking at that business. So yeah, that's what I would say is kind of the business side of dentistry.
Awesome. And that looks like all of our questions in chat. So I would really like to thank you again for joining us today. Your presentation was awesome, and we really do appreciate like your time and your knowledge. And to all of our viewers that are tuning in, we're going to post the link with this Zoom session, like the recorded Zoom session, on our YouTube page, and then you will also have the attendance quiz on the YouTube, the live stream chat. So I'm going to post that in chat as in our group me and in our link tree. So yeah, thank you so much again. This was really awesome. Thank you for doing this for us.
Yeah, no problem. I posted my my email and Instagram there. So if anyone has any other questions, any follow-up questions, feel free to reach out. I'm happy to, you know, share more information or, you know, help out. Yeah. Thank you. Thanks for having me.